This is Outbreak News This Week, brought to you by the Global Dispatch Incorporated. Outbreak News This Week is your source for all the news about worms and germs. And now, your host, microbiologist and editor of OutbreakNewsToday.com. Here's Robert Harriman.
Well, good evening, Tampa Bay, and everyone that's listening online streaming. I appreciate you being here with me this evening, and we're going to start out the show with a little infectious disease history, some research, and the effects of this research experienced decades later. Joining me now is, and he's described by his co-author in a recently published study we'll be discussing a little bit later, as a living legend in the infectious disease world, is Leonard Hayflick, Ph.D. Dr. Hayflick is a professor of anatomy at the University of California, San Francisco, and the creator of the WI-38 cell strain, which was created before I was born. Dr. Hayflick, welcome, sir, to the show.
Thank you very much.
Yes, sir. I really wanted to have you on for two main reasons. First, to get a first-hand account of the history of the WI-38 cell strain, and secondly, to talk to you about the recently published study in the journal Ames Public Health, which details the successes and the number of illnesses averted, the lives saved due to the vaccines made by using this cell strain.
Yes.
So let's go ahead and start out with an introduction for my audience. There's a lot of lay people here. It's not only scientists. And what is the WI-38 cell strain, and what is it? What has it been used for?
The WI-38 cell strain, first of all, is named using the initials of the Wistar Institute in Philadelphia, where I did this work. It is a cell strain derived from lung tissue sent to me from colleagues in Stockholm, Sweden. The lung tissue was grown in what was then called tissue culture, now more properly called cell culture, and its major properties are that it is a completely normal human cell strain. That is, it has the normal human chromosomes, and it also produces a strange event that I discovered when working with this cell strain, and that is it has a finite number of population doublings. That is, it's able to divide, the cells are able to divide a finite number of times, which in this case is about 50. That may sound like a small number, but it's 2 to the 50th power, because a single cell divides into 2, 4, 8, 16, 32, and so forth.
Right.
The math, you get an enormous number of cells. The initial cultures were frozen so that they could last for many, many years. In fact, they have been frozen to this day and are still available to anyone who wants to work with them. They are now frozen for over 55 years, which is the longest period of time any normal human cell strain has ever been frozen. Many of your people in your audience will probably have heard of the HeLa cell line.
Sure.
That is a population of human cells derived from cancerous tissue. So it cannot be used for the production of vaccines or any other products that may be used for medicinal purposes. But WI-38, because it's completely normal and free of any contaminating viruses, which was a problem in the early days of the Salk and Sabin vaccine, which is why they switched to my WI-38 cells, these cells are completely free of any unwanted viruses.
And one point that you left out was the fact that these were fetal cells from an aborted tissue.
Yes, I thought I said that.
Yeah.
I overlooked that. They are from an aborted human fetus that was voluntarily aborted by the mother in Sweden and was then, and still is in Sweden, a legal activity.
Why did you choose fetal cells?
The cells were chosen not for purposes of vaccine production, but for a completely different reason. My interest before these cells were before I found these cells to be useful for vaccine production, was to use them in an effort to determine whether human cancers might be caused by a virus. And it was easy to get human cancerous tissue from operating rooms in a local hospital, but getting normal human tissue was much more difficult. And it was also known at that time that adult human tissue often contained unwanted viruses, like the viruses that cause measles or mumps, and they sometimes popped up in cultures derived from human adult tissue. So the search that I made was for fetal tissue, which was known to be clean, if you will, of any unwanted viruses, which would have interfered with my work. After this, as I was conducting this work with the search for cancer viruses, I made this observation for the first time that normal human cells had a finite ability to replicate and then stop dividing. That was a complete mystery at that time because it was believed for 60 years prior that when you put cells in culture, they would divide indefinitely. That's true of the HeLa cell and other cells like HeLa cells only because they're cancerous. I discovered that normal human and animal cells have a finite capacity to replicate. 20 years later, the explanation for my phenomenological finding was discovered and resulted in the awarding of the Nobel Prize to the two ladies who made the discovery, Carol Greider and Elizabeth Blackburn. They discovered, and many of your listeners will know about this, that as normal human and animal cells divide, the telomeres, that is the ends of the chromosomes, get shorter and shorter. And as they get shorter and shorter, they trigger the chromosome to tell the cell to stop dividing at a certain point. On the other hand, cancer cells express an enzyme called telomerase that constantly maintains the ends of chromosomes at a specific length, and that guarantees their immortality, in contrast to normal human cultured cells that are mortal.
Now, this is my last question concerning the fetal cells. Clearly, this was and continues to be controversial. I'm just curious, what were your thoughts about that at the time?
What aspect are you labeling as controversial?
The fact that, I mean, even to today, there are people that won't vaccinate their children because of this fetal cell line from 1962.
Well, my feeling is this. Aborted fetuses that are either aborted accidentally or willfully, as was done in this case in Sweden and in many other countries, including the United States, where for health reasons or a variety of other reasons, it is necessary to abort a fetus in the first trimester, which is when this was done, that yielded WI-38. The aborted fetuses are, in this country, usually and more often simply destroyed. They're incinerated. And in some countries, believe it or not, there is a requirement that they are buried. But in either case, this results in the tissue being lost, that in the case of WI-38, one cell strain derived from one aborted fetus, voluntarily aborted by the mother,
right,
has resulted in an enormous benefit, not only to people in this country, but worldwide. Millions of people, and we will talk about this in a few minutes,
Sure.
have benefited from the use of this single cell strain derived from a single legally aborted fetus, which would have otherwise been incinerated.
Right. Fair enough. Okay. Now, let me ask you a little bit more about the history. I was reading a report from a few years ago that you hit quite a few different bumps in the road over this cell strain with the NIH and with NASA. Can you talk about that at all?
Well, the so-called bumps that you might be referring to that are reported in a recent book called The Vaccine Race by Meredith Wadman is unfortunately a book containing an enormous number of falsehoods, misunderstandings, and misrepresentations. I will not go into all of the details, but the unfortunate cause of this problem was that the author refused to allow me and other scientists mentioned in the book to read what she had written before publication in order to have us comment on what was written. She was, of course, not present at any of these events 50 or 60 years ago, and so everything had to be described to her and documents had to be presented. So the situation that you mentioned in respect to NASA was very simple. At the time that it was scientists and NASA were wanting to send humans into orbit, there was a fear of the effects of zero gravity on human tissue, and especially on human chromosomes. So that a study was funded by NASA to send WI-38 into orbit and have it cultured in orbit and the cells allowed to divide so that their chromosomes and other normal characteristics could be studied. The cells were sent up in Skylab 2, and stayed in orbit for, I think, 5 or 6 days, parachuted into the Pacific, sent to my laboratory at Stanford University, and determined not to have any changes in their chromosomes. And that was one of the major considerations in the safety considerations when sending humans into orbit. One of the thing that you're referring to that happened is that on the day of launch, a group of anti-choice people arrived at the launch site and tried to prevent the launch from occurring. The launch director, who didn't know very much about my WI-38 cells, called me, asked me for the history, which I explained to him and have already detailed in this conversation. And he held a press conference, told everyone present what the truth was about these cells, and the launch then occurred without incident.
Okay. Now, what vaccines were made thanks to the WI-38 cell strain?
Well, there were almost every human virus vaccine has been made in WI-38. The first one in the early 1960s was a vaccine made for use in the military. It's a vaccine that's not readily available for civilian use. It's called an adenovirus vaccine. But since then, vaccines have prepared in WI-38 against such diseases as polio, measles, mumps, rubella, known to some people as German measles, varicella, which is chickenpox, herpes zoster, rabies, and hepatitis A.
And is the cell strain used in vaccine production in 2017?
Yes, it is. To this day, it is used for the manufacture, for example, of the rubella vaccine by Merck, where it has been manufactured for decades, either as a single vaccine or in combination with measles, mumps, with measles and mumps.
Okay, let's switch gears to the study. You contacted your co-author, Dr. S.J. Olshansky. He's at the University of Illinois at Chicago. He's a professor of epidemiology and biostatistics, to determine how many lives may have been saved, how many people were prevented from getting sick since the cell strain was available in 1962, correct? 1962. Before we get to the numbers, how did you two go about getting the numbers?
Well, first of all, we hadn't known each other for years. We're very good friends, and Jay Olshansky is a internationally recognized demographer and had the tools to do this study. Of course, several assumptions had to be made because these figures are impossible to determine with great accuracy.
Sure.
The accuracy is rough, but we think true enough to come to reasonable conclusions. The essential assumption that Dr. Olshansky made was that prior to the use of WI-38 for vaccines, it was well known what the number of deaths and illnesses occurred, let's say, per 100,000 people in this country and in other countries of the world, when people who had suffered from all of these diseases prior to the appearance of vaccines. So what had to be assumed was that the same prevalence of victims of those diseases would also occur in subsequent years when the vaccines were indeed available, and then determine the incidence of those same diseases when the vaccine was used. That would give Dr. Olshansky an opportunity to extrapolate from the number of illnesses that occurred prior to the introduction of these vaccines to the incidence of these diseases that occurred when the vaccines were now used, which of course was a very small number, as we now know.
Right.
Most of us are not worried about getting polio anymore or any of the other diseases for the reason that I expressed. So that using that thinking, he was able to determine the estimated number of deaths that were averted and just plain illnesses or mortality that had occurred.
So, what are the numbers? How many globally? How many cases of infectious disease did not occur? How many lives were saved based on the research that you guys did?
Since I don't have these numbers committed to memory, the number of cases of polio, measles, mumps, rubella, chickenpox, adenovirus, rabies, and hepatitis A that have been averted or treated in the United States since vaccines made using WI-38 were introduced is 198 million.
Incredible.
The estimated total number of deaths averted from these diseases in the United States is approximately 450,000, including 633,000 fetal deaths from rubella. So the U.S. Rates I've just described, but he and I came up with an estimate of 4.5 billion cases of disease that have been averted or treated worldwide since the introduction of vaccines developed using the WI-38 cell strain. I should mention parenthetically that WI-38 was given by me gratis to every vaccine manufacturer in the world who have profited in the billions and billions of dollars, because this was done in the early 60s when it was not possible to patent biological material, or for the belief that biologists should benefit from their discoveries. Mm-hmm. Today, that would be considered to be ridiculous,
right?
Because thinking has turned around 180 degrees, and that thinking has been turned around largely because of a lawsuit that I filed against the United States government, who claimed that they owned WI-38 when my discovery of WI-38 was never done using federal or taxpayers' money. It was done using surplus materials from from the cancer studies that I described earlier. People might want to know this important fact, and that is that in my judgment, there are at least 4 stakeholders when it comes to the use of human tissue. And those stakeholders are the person from whom the tissue is taken, or the estate of the person, if that person is no longer living, like WI-38. Secondly, the institution in which the work was done. Third, whoever was involved in supporting that research. And finally, the scientists who gave these cells value. I should say also that my colleague, Paul Moorhead, who was my associate in studies, and I have not received a penny for this work.
Well, the work is fascinating. It's done so much since, I don't know how many, 54 years. It's really incredible. Dr. Hayflick, I got about 2 minutes left before I have to let you go.
Sure.
I just wanted to get your thoughts about the burgeoning anti-vaccine movement in the U.S. and abroad.
Yes, it's a very sad situation that has developed in the past decade or so, and that is that many people have decided that vaccines are dangerous. Nothing could be further from the truth. It is true to say that there are occasional vaccinees or recipients of vaccines who do have side effects that are unwanted, undesirable, rarely fatal, because these individuals are peculiarly sensitive to foreign materials put into their bodies. But the number of those people is so rare, and the benefits of vaccines so great, as I mentioned just a minute or two ago, mm-hmm. that to deny a child a vaccine is to have that child flirt with possible disability or death. Many people believe that there are additives in these vaccines that may have caused disease. That is simply not true. The paper that originally described that possibility has been retracted, although it's quoted by the anti-vaxxers, as they're called. And the very figures that I recited here, and that was largely one of the purposes of this publication, was to show people the tremendous benefits that vaccines have for human health. There is no other medication that one could challenge that has resulted in a greater benefit to humankind than have viral vaccines and bacterial vaccines as well.
Yes, sir. Well, thank you, Dr. Leonard Hayflick, for your time and expertise. And, sir, the world owes you a debt. I appreciate it.
Thank you very much.
You bet. Okay.